New story out by Jeff Biggers at Huffington Post. He's under the green tab. He's in the Huffington Post green ghetto when this should, in fact, be on the front page, because this is about Americans being killed by corporations. But instead, it's over in the green ghetto. Headline, breaking. New study links mountaintop removal to 60,000 additional cancer cases. 60,000. 60,000. Brand new breakthrough study just out. Came out last night. Published in the peer-reviewed, that means other scientists looked at it and said, yep, looks good to us, makes sense. Journal of Community Health, the publication for health promotion and disease prevention. It is a study led by West Virginia University researcher Dr. Michael Hendricks. It was an idea and the article was worked on as well by our good friend Bo Webb. Dr. Hendricks and the team gathered together a group of college students who spent their spring breaks, instead of going to the beach, went door to door in communities in the Coal River Valley of West Virginia, asking questions from a set list. The study is called Self-Reported Cancer Rates in 2 Rural Areas of West Virginia with and Without Mountaintop Coal Mining. They went door to door through Appalachian communities that had mountaintop removal near it and nowhere near it. And the differences were staggering. The cancer rate was twice as high in a community exposed to mountaintop removal mining as it was to a non-mining community. Dr. Hendricks said this significantly higher risk was found after control, pay attention to this, was found after control for age, sex, smoking, occupational exposure, and family cancer history. I can't stand it. Sometime in the near future, we will probably be getting surgery on yet of my children, getting yet another teenage gallbladder removed. Teenage gallbladders aren't supposed to just go, oh, sorry, didn't work. When my son was born, he was born with a birth defect. He has all his fingers and all his toes. But when he was teeny tiny, he would breathe. And even though he was full term, his trachea would collapse and he would turn blue because it was defective. He was born with a wheeze, and he still has it. It's very active, so it's hard to notice, but it's there. So I guess we've got skin in the game, as they like to say in Washington. It's a strange and discomforting thing to know that the very world you are in itself is a ticking clock, is a dice roll, is a spin of the roulette wheel, and that for someone you know or someone you love, the hand will stop, and so will everything else. I love nothing better in the fall than to get up early on a Saturday morning and start driving up Interstate 79 toward Morgantown. As you do it, you'll be passed by cars bearing navy blue flags with the gold Flying WV logo on it. They are the Mountaineer faithful, and they are on the way to Mountaineer Field. A really good house there, pretty close to packed, is 60,000 people. Imagine an entire football stadium on one of those miles-high bluebird, perfect blue sky autumn days with the leaves turning a riot of russet colors. Imagine that stadium packed with 60,000 people in blue, old gold and blue, and all of them cancerous. That's what this means. That's what this study means. In a state with only 1.5 million population, 60,000 here and 60,000 there, pretty soon you don't have a population. Pretty soon the state has been depopulated. Go study up on what deliberate depopulation means. See if you run across the phrase ethnic cleansing. See if some discussion of depopulation you run across genocide. That's where the science is taking us. And for what? For less than 5% of the coal produced in the United States. All of which coal is toxic. But at such a small percentage, the only reason it is dragged and scraped and tormented and tortured from the mountains is because of one thing: profit. Because I remind you, we could stop this tomorrow, and no one's lights would even dim.